Welcome to the Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner who helps physiatrists start and grow their own profitable practice so they can achieve financial independence and live without limits. Welcome back. This week, I want to touch upon bundled payments and care versus cost. So I don't know if it was a couple years ago, maybe even more than that, but the CMS, Medicare, basically came up with a system or programs or diagnoses that they wanted to see if they can achieve cost containment. Basically what that is they have certain diagnoses where now they're offering a bundle of money to basically cover the episode of care for these particular diagnoses. No, in my particular area, one of the big bundles, initially it started with the BIPSI, so joint replacement. And I think they've had some pretty good success with that in terms of once the patients have that joint replacement, as opposed to going to skilled nursing level of care, some of these patients go home with home health or just transition straight to outpatient therapy. And I mean, if you think about it, most joint replacement patients are pretty healthy. They have that joint put in, technology and healthcare such that now these patients can go home, have good outcomes, and kind of get back to life relatively quickly. But with certain diagnoses and certain conditions, it's not as advantageous or beneficial for these patients to kind of transition straight home. But what happens is with this bundled payment for the episode of care, what's happening is people are trying to find ways to maximize revenue. So if you think about it, if you have a set amount of money that you're paying for an episode of care, what you want to do is you want to minimize the cost of that care for that particular patient. I think in the rehab world, this is concerning from the standpoint that if you have a patient who had an acute stroke, they have this bundle of money that they're utilizing to pay for the care of this patient. You don't want them to send that patient to an inappropriate level of care because it saves in terms of cost. I think some hospital systems are participating in certain bundles, some even stroke bundles, and you see this on the back end in terms of as this patient transitions, they skip a certain level of care that may be more appropriate, just so that they can kind of cut on cost, save cost, and at the heart of it, kind of hurts the patient. And I think, again, as physiatrists, this is going to be important for us to kind of play a major role in terms of seeing the patients, making that recommendation, and really advocating for the patient going to the right level of care for the first time. Because a lot of times, even if they do go to a lower level of care, if they're not getting adequate therapy to maximize their function and get them back to the most functional level, they could potentially readmit to the hospital. So you save on the front end, quote unquote, but you're going to pay on the back end because the patient's not getting better, they're not getting the care that they need, and they're eventually going to go back to the hospital. Because if they have incomplete or inadequate therapy, they still have functional deficits. They're not getting assessed for the braces they may need to help prevent falls. And if they do have a fall, they're going to go back to that acute care hospital, and that's a different episode of care that that hospital is going to be on the hook for. So bundle payments, they can work if you have the right diagnoses. I think that's been borne out with the joint replacement, but for certain diagnoses, strokes in particular, it's probably not the best move in terms of not getting that patient to the right level of care. It's going to be a theme on the Rehab Roundup is right patient, right level of care. As physiatrists, that's what we do. We are the post-acute specialist. Again, this is Dr. Hassan. This is Rehab Roundup. Thank you for joining me. Look forward to talking to you again next week. Dr. Hassan, board certified physiatrist, independent practice owner, helping physiatrists start and grow their profitable practices so that they can achieve financial independence and live without limits. You can follow me on social media at Dr. Hassan Rehab, DrHassassanRehab. Look forward to talking to you next week.